Hi guys, and welcome back to
Scrub Mentality. I'm Meishin.
I'm Frances, and we're two nurses here in Australia exploring the land down under.
And so today we're gonna discuss about the difference the UK versus the Australia emergency nursing. So emergency nursing is a very high stake demand in the environment. It's
True.
quite fast paced, but it feels like when you work in the ED, it can vary differently between different countries as well, right?
Yeah.
So if you're a nurse thinking of moving between the UK, going to Australia, or either from the Philippines, or just curious basically, this is for you.
Yeah. So today, please join us as we break down the real differences from pay to patient ratio, from rainy nights and sunny rostered day offs on the couches. Yeah, let's talk about something that nobody warns you until you live it. The culture shock of stepping into an emergency department in a whole new country.
Yeah, yes, you can read all the policies, but
Yeah.
nothing tells you what the vibe will be really like.
It will be different,
I know, you
yeah.
walk into like the handover and suddenly,
It
boom,
feels different.
it's a different environment. So we're gonna discuss to you between the roles and scope of practice, the difference between the UK and the Australia.
Yeah.
So the
Yeah.
UK, we work under the NHS and the agenda for change pay bands.
Yeah.
Yeah, you can become either an ACP or an ENP, where you often assess, diagnose, treat. You can even discharge minor cases in there.
So there's loads of options.
Yeah,
for
you've
you.
got
Yeah.
you've got functions that you can do independently back
Yeah.
in the UK.
I mean, you have to consult senior decisions, but you'll see a patient, you'll diagnose, you'll order a test, you'll give medications, and then you can discharge a patient. So I think it's especially those who doesn't want to go to managerial roles, they tend to go to the advanced clinical practitioners pathway because they want to be involved more in clinical care. I
Yeah.
think that's what their reason for. We know loads of people who are ACPs back in the UK. So yeah, they said that's the reason. Yeah.
And for career advancement as well.
Yeah, because sometimes you feel like you're stuck, that you need to upskill, but doesn't feel like. I think being an ACP would be like a good option for you.
Yeah, as long as you've got the brains.
Yeah, the brains to study, and it
Yeah.
will take your time as well because you'll have exams and stuff. But if you're in it, so yeah, just go with it. Next, we're gonna go with the Australia. The difference with the roles with the UK is there's also a pathway to nurse practitioner, like in the UK, which you can prescribe medications as well. There's a strong emphasis on the different roles in the A&E, in the emergency department. So they have triage nurses, they have resus nurses, and like here, we've noticed that there's lots of postgraduate nurses. So yeah,
It's one thing that they encourage in here.
yeah. Because I think postgrad nurses, you'll be able, that's the only time that you can triage and you can go to resus. I'm not sure that's in our hospital.
Yeah.
How about yours as well?
It's the same.
It's the same.
They-
I think
You've
it's
got
old Victoria, yeah.
you've got limited functions as a nurse when you're not doing the postgrad. So it's gonna be another discussion.
Yeah, we're interested in the topic. So
Yeah.
we'll prepare a video for that as well.
So in the UK, we are regulated by the NMC, which is the Nursing and Midwifery Council, which you have to revalidate every 3 years.
Yeah.
And then obviously you have to do the thing, you have to pass the OSCE in order to be a registered nurse.
If you're an overseas nurse,
Yeah.
if you practice outside the UK.
Yeah.
So for Australia, they have what they call AHPRA, which you usually hear when me and Meishin discuss about things about Australia. AHPRA and NMBA, that's a nursing and midwifery board or something. International nurses as well must be clear for UNMAC if they're for migration, like permanent residency pathway. They have to have English tests and they have to have OBA pathway. And then also permanent residency pathways often tied to sponsorships or rural placements that we discussed in our previous videos.
Yeah.
because usually people doesn't tend to go to regional, so there's more offer for permanent residency there.
Exactly, yeah. This is too serious already.
I know.
We've got
Shake.
to what
yeah.
have you noticed, like with regards to culture, environment?
So workplace culture, I think in the UK we always call it our department is in chaos, but organized chaos. The whiteboards are full, the ambulances are queuing, and someone is chasing obs 5 minutes into the shift, or else changing pads last minute. So it always happens.
Yeah, but meanwhile here in Australia, I've noticed that some chaos, they've got chaos as well, but it's more structured. They love protocols in here.
Yeah, I've noticed. Yeah, there's a pathway or protocol for anything that we do. Yeah.
What about the UK morale?
Yeah.
Haggard. Haggard, you're short staff, always under pressure. Management offers resilience workshop as a solution in there.
I think the UK, they always, because they know that the staff are pressured, so the management also tries their best to like support in their own way, like resilience workshop, like you said, de-escalation trainings or workshop as well. But as always, the staff would rather be off the shop floor and rest at home. That's just my personal opinion. Rest at home and sleep. But these are very helpful.
Yeah,
it's just
it
that
does.
the workload sometimes, they would like to rest more than to attend the seminars or workshop that they have. So here in Oz, the support here is more real. So staff to patient ratios are better.
Yeah.
You get mental health debriefs after major events. The burnout is slower. There's burnout. It's slow, but it is still real. So it's still there. So here in Oz, about support, we have clinical educators for every, like mental health clinical educator. For only ED or postgrads, you have mental clinical instructors as well. So they're well supported, and the staff patient rate 1 to 3 for
1
A&E.
to 3. Can you imagine 1 to 3?
Yeah, I was shocked as well when I arrived. I only
it's
got
real,
3 patients. it's not scam. It's real.
So when they say you're busy, but at the end of the day, you've got 3 patients.
You've got only 3 patients. It won't go beyond that. It's more in resource. They have 1-to-1.
Yeah.
So that's really different. But I think that should be the standard.
That should be the
that
practice,
should be the practice. Yeah.
When it comes to lifestyle, work-life balance, we've got a lot to talk about in here.
Yeah.
Yeah. Let's be real.
Yeah.
Yeah. What do you think in UK? What
UK, I always told you that I felt like time was so fast in the UK. It's very fast paced. It's like I logged in for my morning shift, and then I finished at night, and then the next day again. It's fast paced.
Yeah.
We've got 12-hour shifts, 10,000 steps or more, and a cold adobo that was on the fridge from 2 days ago. That's our usual practice.
Yeah. And don't get me started with the rotas. We've got way different rotas in there. You suddenly have like 4 nights in a row, and then you're off.
2 days off.
2 days off, and then
Back on nights.
yeah.
So it's crazy, but sometimes you get good rotas as well. So it's just, I think they're giving chance for everyone.
So do you think you've got more better work-life balance here in the Australia then?
I can't say for now because I've been here for 3 weeks and I've been at work for 2 weeks. But what I've noticed is in the UK, after my shift, even though I'm off the next day, I feel like I want to rest more.
Yeah.
While here in Australia, because we only have, in the UK we have 12-hour shifts. Here in Victoria, Melbourne, we have 8-hour shifts. So you have to, if you're full-time, you have to go to work 5 times a week. But then when you go home, it's still 3 p.m.
Yeah.
You still have time if you want to buy groceries.
And there's still sunshine.
And the main thing, we still have the sun. So as I sit here in my in our living room and I look at the window, I've finished 2 movies after my shift, and there's still sun. So it just feels so good. The time is slower. I think personally, I think it's slow here, and I feel like I've rested enough once I've slept. Yeah, not like in the UK that I'm always tired when I go home from a long day shift.
It's like you can't do anything after a shift.
You want to, but your body is like shutting down
automatically. Here in the Australia, our roster are done advanced. So just like now, my roster for September is already done.
Same, yeah.
Yeah. What about breaks?
Breaks in the UK, because it's too busy, sometimes you forget.
And sometimes, can you remember, even if we're on our break and then someone is arresting, they will call
Yeah,
you
yeah.
out in there.
Francis, can you go back to recess? You've got a pre-alert, cardiac arrest. So of course you have to go. Of course you have to go back.
Yeah.
I think it's because you know that you're there, that you
Yeah.
should. But in Australia, it's different,
If it's
right?
break, it's really break.
They respect your break. You won't be bothered. Whatever happens, there happens. You just sit. You can actually sit and eat your food.
Yeah.
Yeah.
What about the pay though? Like the difference between the UK and the Australia pay, you can really see a difference. Well, yeah.
You can compare. I haven't received my salary yet. They should have got like months of salary already. So
Right, let's talk about salary. So when you go in the UK as a band 5, you start as a band 5, but in my case, I remember I started as a band 4. Before the OSCE, you start as a band 4, unfortunately. So the band 5 starts between 28,000 to
around that.
34,000 pounds. Obviously, it has enhanced
Yeah.
pay when it comes to like nights and weekends.
But I think that's different from when we started. I don't think it was 28,000.
Yeah.
It was so much lower
I think it was
than that.
21 when I
Yeah.
started.
It was so low. They just had like agenda for change, pay increases and all that. That's why it went to 28 now. So lucky for those who,
Yeah.
because the cost of living is really high, and some trusts will charge for. They said, I don't think in our hospital before
Yeah.
that they charge nurses for parking at work. But I mean, come on, it's already, the cost of living is
Can you
already high.
imagine?
Yeah, you
Yeah.
have free parking. Imagine paying to suffer.
Yeah. What about, well, in Australia, how much are you getting paid? So it depends on what grade are you in.
Let them know how much
So it depends on the grade. Annually.
She's grade 8, which
So-
is the top
Yeah.
band for
Yeah.
nurses.
So in ED, approximately, it's around $90,000 to $120,000.
That's before penalties.
That's before penalty.
Basic pay, that's
Yeah.
basic.
So it depends. So it didn't include nights, weekends, public holidays, and let me mention on holidays.
Oh yeah,
You've got like 50% penalty. And it depends on, the trust. It depends on the hospital. So it varies.
you can easily hit 6 figures if you have weekend nights,
Yeah.
bank holidays. Can you imagine?
So that's a pulling string to you guys. You need to come here. And regarding, I'm not sure about the parking. I'm not really quite good in parking. We don't drive, but I believe
Passenger
on my
princess.
current hospital, they're charging like $5 in a day.
Oh, same. Almost the
Yeah.
same with our hospital. I think it's $6.50 if you wanna park just really into the hospital premises. You don't have to walk long. Yeah, so they charge. Yeah.
Well, what about your life outside the hospital, though? What can you say?
I'm just, I can't, what I've noticed, people like to, because it's winter here.
Right now,
Yeah,
she
right
arrived
now,
at winter.
yeah. I arrive at winter, so I can't say much. But I like going to malls, I think, because it's so cold outside. So
I wonder why.
malls are warm for shopping, of course. But yeah, I think. But the only difference is that the mall closes here at around 5 p.m. Can you imagine? In the Philippines, they close at 10
p.m.
In the UK, they close around 7 or 8, but here 5. That just only shows that they really want everyone to experience work-life
Yeah.
balance.
Which is
You
a good
feel like
thing.
you can breathe.
Yeah.
Like it's like a breather. But for me, I like going to malls. I'm a homebody, so I stay at home most of the time or go to charity shops.
Yeah.
Like yeah, those are the things that I've done here. How about you? You've been here for a while.
Yeah, so for me, as soon as I arrived here, I really felt the difference, the lifestyle, the weather. Like every after shift, you can still go out. Sometimes we even go to the beach after a shift. Can you imagine? Because we're like 20 minutes away from the beach.
That's good.
Yeah, so it's a good
I'll
thing.
try that on during summer.
I know.
Yeah, because you still have energy.
Yeah.
Then you can rest in the night and then wake up again, work, and then you still. I don't know. It's just maybe a difference because we have a different shifts in the UK.
Yeah.
12 hours.
12
And
hours
here-
is too much sometimes. But
It's
I do miss
13.
it though. 13 to be
Yeah,
exact.
yeah.
Yeah.
We maybe miss it, but if we didn't know that this was the easier life, especially we've got kids, at least we can see
Yeah.
them more. Yeah.
While UK lifestyle,
it
it
has
has-
its own. It has its own
Yeah.
charm, actually.
Yeah.
UK, yeah.
Europe is nearby. Paris
Oh
on
my God!
weekend.
Yes, my friends in London, because they live in London. Some of them. London's very accessible for because you can just ride on a train, go to Paris,
yeah.
30 minutes, go to wherever you want. So you're already in Europe.
Yeah.
for your
I can
day off.
remember like because from Leeds going to London is very expensive, right?
Yeah.
I'd rather go to Europe because the plane ticket will only cost you like
18.
30,
Yeah, sometimes,
30
yeah.
pounds. Can
Back
you
and
imagine?
forth,
Back
yeah.
and forth going to Europe. So, but for those UK winters, I miss UK winters though.
Yeah.
But it gets to you sometimes.
When you like during UK winters, so winter is all year round. You finish your 12-hour shift, you step outside, it's raining, it's 5
Freezing.
degrees, and you're questioning life.
Yeah.
Like,
Why
is it dark outside? You log in dark, you go out dark. So it's just sometimes it's a struggle, but then UK has its own charm for
Yeah.
winter. I'm gonna miss White Christmas.
I
Really.
know. It's
Like,
something I miss actually though. Yeah.
I mean, UK was wonderful. Yeah, yeah.